Thank you, Elise. So I do this at every session. Just show of hands if you are a Better Work Tasmania member. Good, good. So those still not a member, it's really easy to join up, free of charge. 6-letter password, no numbers, no capitals required, dead easy. And we'll get that membership up even more. So our next speaker, Dr. Angela Martin. Most of you would know Angela, formerly of UTAS. Her presentation, the why, the what, why and how of psychosocial working conditions. Thank you, Angela.
Thank you, Pamela, and good morning, everyone. And also to our people following on the live stream, thank you very much for taking time out to listen to what we've got to say today. Firstly, I'd like to thank Better Work Tasmania for inviting me to speak to you. I've spoken at quite a few WorkSafe events. I've been working in partnership in my role at the university for quite a long time, so many of you will know me. But if you don't, just quickly, my background and my perspective on this area is from organisational psychology, which is about how organisations are a social environment that affect people in psychological ways. So I started out my research career looking at how people adapt to changes in the workplace, and in particular what I found was how leadership and positive team climates act as a kind of coping resource to help people manage the stress of organisational change. So I've been working in a business school for the last 13 years teaching managers and working on a variety of projects in this area of work psychology. And now I've decided, I've learnt a lot over the last 13 years, but I'm ready to be in the field of practice. So I've started my own business called Pracademia, which is all about applying research in a practical way in workplaces. So I'm still honorary at University of Tasmania. They've made me an honorary professor there so that I can still contribute to their mission. But for the next however many years, I'm going to be really focused on practical approaches. Okay, so workplace stress, which is sort of a general term. I'm going to try and unpack a little bit about what sort of factors are causally related to that feeling of being stressed at work. My objective for the talk today is to go back to basics about what are psychosocial risks and how they relate to mental health, because what I see in my work, and I'm sure many of you will agree when we did the polling question earlier on, is a lot of organisations are starting to get the idea that you need to respond to mental illness, but there's still not really a lot of due diligence in terms of thinking about the prevention side of things. So bear with me if you do already know quite a bit about psychosocial risk, but for those that have come along for the first time or think that that sounds like a very technical term that they don't really know what to do with, I hope to sort of demystify some of that for you. Okay, so when you look at this picture, what's the first thing you think of? Just firstly into your mind. Anyone willing to share their first thought? Heights? Okay, great, thanks. So when you look at it, I think we think physical safety at work and we accept that something that you might do at work could harm you physically. So working at heights requires, all sorts of equipment to try and reduce that risk and protect the worker. But we need to move more now. In the last few years, it is starting to happen, to accept that things that happen to us at work or things that we do in our jobs may actually also present risks and harms to us in a psychological way. So they may erode our mental health, but on the flip side, also things that happen in the workplace that are very positive can promote our mental health. Okay, so I know WorkSafe Tasmania had a campaign on home safe, which is obviously super important, reducing deaths, absolutely. But what about home well? Sending home your worker at the end of the day frazzled, stressed, tired, worried. Also, we know that working conditions are associated with suicides, and anyone who's been following the recent research reports on suicide knows that there's an alarming increase there that we need to look at. So that's an extreme example, suicide. I would like to draw attention to Alison Milner's work, if anyone's interested in following that up, and she's shown how working conditions are associated with suicides by looking at coroner's data and things like that. But what I'm sort of thinking is the more common or the less pointy end of this issue is mental wear and tear, if you like, if you think about it on a daily and cumulative basis. We can also have injuries psychologically, which I think one of our other speakers will be talking about. But what I'm, focused on is this slow health deterioration process, both mental and physical, that can result from work stress. Obviously, it's a very complex interaction between a worker, their personality, their lifestyle, what their skills are, what kinds of support they have, and this interacts with their job, their work environment, and the groups and people that they interact with in the course of their work. Okay, this picture here sort of reminds me a little bit of me at the university. And I'm sure lots of you who are working in kind of office or government or corporate situations can probably relate to this particular picture. And so what we're wanting to look at with psychosocial risks is sources of stress. Anyone who has seen Professor Carrie Cooper speak before, which is a real treat, he's a very prominent researcher from the UK, talks about how stress is the new normal. And it's the black plague of the 21st century is what Professor Cooper has called it. But basically, over the last 20 years, what we've seen is high levels of work intensification, do more with less, globalisation and economic changes going through the financial crisis, decrease in collective bargaining that we can see in our workplaces, and of course technology has changed so much, and all of these have had impacts that have led to a lot of people feeling plagued by work stress. A colleague of mine who you've probably seen present a few times, Tony LaMontagne, calls job stress a kind of social pollution. And if we think about being, corporate responsibility, if we think about corporate social responsibility, what we want to do is obviously minimise or reduce that stress. Even some of the research I've been involved in shows a link between parents' job stress and things like child development. So it is a very important thing to be looking at a societal level as well as in workplaces. Okay, so there's a lot of research to document the extent of this problem, but the problem is not going away. So what are we going to do about this? We're all here because we're stakeholders, we're employees, employers, we're occupational health specialists, and these things all impact our families, society and the economy. So I've been working with Professor LaMontagne on developing an integrated approach to workplace mental health. So you may have seen Tony present this at the breakfast we had in October. And what this is basically trying to do is bring together three main kinds of ways of looking at this problem and integrate them. So what I said earlier is that we've probably seen an increased focus on managed illness. So thank God we've had Beyond Blue doing all this fantastic work about depression, anxiety, substance abuse, and how workplaces can sort of manage and cope with that. But an area that I've been really working on as well is this promoting the positive, a strengths-based approach, because we can boost people's mental health by promoting these factors. But what I want to talk to you today about is more on this prevent harm aspect, so doing our due diligence to try to protect people's mental health. Okay, so it's a word that probably puts a lot of people off, psychosocial. What is that? Okay, so there we're looking at how you can see the interaction between social structures and social contexts and the individual's emotional, behavioural and even physiological processes that have been documented. And working conditions are obviously the extension of that. So if you think about the definition of how you perceive and react to the social aspects of your work and work organisation. Okay, it varies for each individual, but I think what's really important is that when we talk about conditions of work, these are perceptions that are in common by groups of workers. It's not your own individual perception. I think if we think about working conditions, we can think about things that affect everyone. So in a very simple sense, it's how we make sense of our work and how it affects us. I think this issue about perception is really important to mention because I guess one of the barriers to psychosocial risk reduction is the attitude that it's the individual who's responsible. They just perceive it negatively because they're a negative person, or they're already depressed and so they perceive their workplace more negatively. So this occurs, but with some methodological innovations, we've been able to try and remove some of that individual variation and look at these as group level constructs. So I think that's quite important to not get caught up in is this subjective or objective experience, because regardless, the outcomes are the same. So if someone perceives their work to be unfair, for example, it impacts their mental health whether or not the next person thinks it's unfair. Okay, so some research insights that I wanted to share with you regarding the problem. There's a lot of research out there, as I said, just a few insights here. Superfriend is an organisation that's been doing a lot in the area of mental health, and they have an annual work in progress survey. Their latest study revealed that nearly half of all respondents have left a job because of a poor mental health environment. And despite increased awareness of the importance of mental health at work, they say that there's been a decrease in recognised wellbeing factors. For example, fewer employees think that their managers give clear guidance and direction on what is expected of them, and a decline of 10% from the previous year. Other surveys, like the Australian Psychological Society Stress and Wellbeing Survey of 2015 results showed 32% feel stressed by workplace issues. There's also the Australian Workplace Barometer project. This is a landmark Australian study by Maureen Dollard and colleagues at University of South Australia. A standout finding there from this project is depression costing Australian employers approximately $8 billion as a result of sickness absence and presenteeism, and $693 million of this is due to job strain and bullying. So Maureen Dollard's indicator that she is studying at the moment is called Psychosocial Safety Climate. So it's taking what we know from the safety climate literature and putting that into place to understand how psychosocial working conditions can lead to poor mental health. She has 4 indicators that are in her index: leader commitment and involvement in relation to the stress prevention practices of the organisation, management priority, which measures employee perceptions of how management values psychological health and safety in comparison to productivity goals, organisational communication, which encompasses processes for employees to provide feedback on their psychological wellbeing, and organisational participation, which is about consultation with health and safety reps, unions and other stakeholder groups. So results from the Workplace Barometer study show that working hours are a major issue in Australia, with over 40% working more than the standard of 38 hours and 18% working longer than 48 hours a week. So work hours alone is a very important determinant of mental health. There's been all sorts of modelling done showing the sort of trajectories that put somebody's mental health at risk if there's a sustained long working pattern like this. Work-family conflict is another major area that contributes to poor health and wellbeing. In this study, they showed that levels of bullying are at about 6.8%, which is substantially higher than international rates. I was involved in an interesting discussion about bullying yesterday because I know one of the other speakers will be talking about, whether certain behaviours constitute bullying or not. Things like being yelled at work, being humiliated in front of others, unfair treatment and negative comments regarding gender and ethnicity, even including 6.3% saying they'd been physically assaulted or threatened So I think violence is a major issue in many workforces, and sexual harassment obviously included there. Most of these things, even if we don't say they would be upheld as a bullying case, are indicators of a poor work culture. So many of these, I can see Graham Gourlay here, who's studying at the university about how to prevent bullying through culture building. So Tasmanian workers, there was a little bit of data in there, and it showed that health and community services needs a lot more focus. So if you're in that sector, I know you're working very hard on these issues. And manufacturing, personal and other services also showed some poorer outcomes compared to other industries. HILDA survey, which is the Household Income and Labour Dynamics survey in Australia, run by the University of Melbourne, gives us the opportunity to have some sort of surveillance at a national level of what's happening with some working conditions. I thought interesting to share with you because we all know how mental health can be affected by unemployment. An interesting study by Peter Butterworth and colleagues looking at transitions, because this data is longitudinal, we can see patterns over time. So going from unemployment to a poor quality job is actually worse for your mental health than staying unemployed. However, if you go into a high quality job, you see immediate boosts in health and well-being. So I think we've got all these sources of data and all this research, but we need to get to the point now of changing things. Okay, this is a global pattern around the world. I just wanted to bring to your attention some Australian research. Okay, why does this matter? I don't think I probably have to convince you too much, because when we did the poll at the beginning, 80-something% of you said, yes, it does matter, it's very important. But there's a lot of, again, reasons why we should focus on mentally healthy workplaces. We've got our legal reasons here. We're lucky to have someone from the legal profession talking to us this morning. So health and safety risks arising from work must be effectively managed by eliminating or minimising risks so far as reasonably practical. This is to protect workers against harm of their health, safety and welfare, including their psychological health. So we have this legal obligation, and as I said, I think there's not a lot of due diligence occurring in many workplaces in Tasmania and Australia. There's a lot of case law evolving around Fair Work Australia, which we might hear a bit more about. But most people don't get involved in the legal system regarding their health and well-being at work. So thinking of an ethical perspective, do no harm. Try to make work a reasonable experience. It's never going to be 100% all happy, clappy times at work. But, can't we have some sort of experience that it overall enriches our lives, not just financially, but in other ways? There's very good evidence now on the economic impacts of poor mental health for employers, society, and the individual as well. And this is now a pretty well-established evidence base, good return on investment studies, and almost all of them, regardless of the methodology, show a positive economic benefit. But I think what's really interesting as well is this one around reputation. So because our co-sponsor is employer of choice, obviously it's becoming increasingly important as a way of attracting and retaining talent, of gaining a competitive advantage. So for example, if you're in the service industry, there's a lot of studies to show that stressed workers interacting with customers doesn't produce the best service evaluations, for example. So there's a kind of a leakage of stress that occurs through these transactions, whether they're with patients or customers, whether you're working in the public sector and it's in the public interest to be efficient and effective in your work. Okay, so there's a few little research insights that I want to share with you on mental health impacts of psychosocial working conditions. So I'm focusing here on mental health, but equally there's very good evidence around cardiovascular health and musculoskeletal disorders. So probably the most famous studies in this area were the Whitehall studies in the 1970s. If anyone's interested in the work of Marmot, who looks at social determinants of health, fantastic work. And over the last 20, 30 years, many of these findings have been replicated, and methodologies have advanced now to the point where we're pretty confident that these associations between psychosocial working conditions and mental health do exist. Okay, so this is where we're tracking people over time and seeing the odds increased of developing a mental health disorder. So a couple there, one from, again, my colleague Tony LaMontagne, showing that about 15% of depression could be eliminated if we focused more on reducing job strain. Job strain is sort of defined as the combination of high work demands with low work control. So you can't really control or pace the way the demands are coming in to you. Another one on justice, and this is basically organisational justice is looking at all types of unfair treatment. So the risk of onset of major depression for people reporting medium or low levels of justice is up to 2 to 3 times the risk of developing major depression over time. So that's a pretty robust finding also. The European Working Conditions Survey of 33,000 employees from 34 European countries revealed a significant association with poor well-being among both men and women for these factors: quantitative demands, such as workload, demands for hiding emotions, which in service work or patient care work can be quite strong, low possibilities for development, low meaning of work, low role conflict, low quality of leadership, low social support, low sense of community, job insecurity, low job promotion, work-life imbalance, discrimination and bullying. So if you want to know what psychosocial factors are, that's the list. And they're the ones that have shown these associations very robust internationally as well. And almost, interestingly, the 34 European countries, almost no country or occupational differences were found in these associations. So we can be pretty confident that these are generic factors. I think the main point I want to make here is we have fundamental human needs. So fairness, being treated fairly, equity, being cared for, treated with respect, having a sense of control over your work, self-determination, affiliation, a need to grow and develop. These are basic human needs, and these are critical to our mental health. And I think they're what's at the core of a lot of these psychosocial working conditions. Okay, so areas of action. All this research we've tried to distill down into a set of guidelines for organisations. I'd like to acknowledge Nicola Reevely as the lead author of this work. And what we've done there is try to provide some sort of practical guidance to organisations based on the evidence that is out there. So if you have a look at this list, you can see I've mentioned fairness, job demands and control, thinking about the work environment and supports, leadership. So great that we need mental health education and we need a strategy and policy, but these are some of the most important factors on the list. And I'm happy to send you the link to those guidelines if anyone is interested. Okay, so what do we do? This is your core business, is doing this, right? So if you're just starting out, you haven't done a psychosocial risk assessment before, the first thing to do is to get some data, to get a profile, to have a look at, especially if it's a large organisation, does the risk profile vary by occupation, by location? Thinking about analysing your baseline picture before you start to put strategies in place. A lot of organisations do culture surveys that pick up some of these factors so they can be useful data. And obviously it needs to look at all of your HR data and other types of data available. Then you need to obviously have some action, design the plan, Really important there to have a team if possible, leaders as champions, and think about the capabilities in the team, the resources of the team, what's feasible, because again, remember the legislation is what's reasonably practicable. So the other thing I wanted to mention was it's important when you're doing the actions to conduct what we as researchers call a process evaluation. So it's tracking the implementation, because you might think the program's being implemented, but what we know is that often in the middle management level, things get stuck and they may not be happening as expected, and there are probably valid reasons why. So really important to actually track what's going on during your implementation phase. As I said, thinking about what you can realistically change. We can't make everything perfect. Some job demands are just inherent in the job. But it needs to show good faith to employees. If there are fundamental issues, like ones I mentioned before, like violence, and they're not being addressed, you're really at risk there in terms of being able to meet your obligations. Evaluation is very important. Again, if you've got a good baseline picture, you should be able to continue to track and continue to improve over time. So you might start off with one factor and next year look at another one and another one. Can be quite overwhelming to get the results of your first psychosocial risk assessment. And I think what we might get to in the future would be some things around benchmarking these, having some groups that are in similar industries and types of businesses. We might even get to the point, who knows, with having some kind of national repository of reports like we do with equal employment opportunity. So you're in on the ground floor getting started with all of this, so good on you. Okay. So that looks quite simple, but actually in reality, for many of you that are doing it, there's always more to learn and more to improve. I don't expect you to read that because the writing's small. I put that one in there because you could have the links from the presentation to follow up. These are some of the tools that I would recommend to do psychosocial assessment. And I've probably talked to you before about many of these, but for anyone who hasn't heard me speak about these, there are the links. The interesting one to mention is that the Institute for Safety, Compensation, Rehabilitation Research has provided a snapshot review of workplace stress evaluation tools. And this can help you to pick one that is more appropriate for your particular work environment. They vary in length and complexity, and we all know getting people to fill in surveys can be a bit of a problem, getting a good response rate. So looking for short forms of measures can be very helpful. The UK has some great stuff with the Health and Safety Executive, and in a minute we're going to have a look at their brief diagnostic tool, and you'll get the chance to use the polling tool to have a look at that. So the main thing I wanted to say is that what you do has to be suitable for your size and sector, but you must be doing something in this area. If you're only looking at responding to mental illness and not looking at how to prevent mental ill health, you're sort of missing part of the picture. And so you might just end up increasing the number of people that you have to respond to with mental illness. In small businesses, I've seen people do quite simple things, not even a survey, but they have a team meeting where they create a log of common stressors and brainstorming solutions with management commitment. So that can be quite a small thing, but it does probably fulfil that idea of monitoring risks and implementing solutions. Also a caution that if your senior leaders don't support the commitment to change based on the results, it's a pointless exercise because all it does is increase cynicism among employees that I provided this feedback and you did nothing about it. In fact, sometimes it can get worse. So that would be the first thing to work on if you haven't done any psychosocial risk, is gaining leaders' commitment to a genuine agreement to act on results. Okay, so this is where I want to do a polling question that Pamela has set up for me. I think we just have to change the slide in order to get you to be able to answer some of these questions. This one is the Health and Safety Executive from the UK's brief indicator tool, so it doesn't have heaps of questions. It's one of the shortest ones available, and it's called the First Pass tool. So a lot of organisations will start with something like this. So please bear with me while we get changed over. Okay, so for those who were here when we did the practice polling questions this morning, I want you to think about in relation to your job. So you're answering this just on your own behalf.
There's only 4 at the table. You'll see your little voting. So if the second group... No, you'll have 2 chances to vote. So 4 if you grab one of these and vote. Yeah. And then pass it on to someone.
Someone who hasn't had a turn can vote with the same question. Okay, so looks like a lot of people have unrealistic time pressures. I think that's something that we can relate to with what I said earlier about is stress the new normal and work intensification. So thinking what could you do to try to reduce unrealistic time pressures? As I said, it's not easy to think about the strategy that's next to do that. So workload management, ensuring that teams are adequately resourced for the tasks that they have, and having some way of managing workload so people can feel at least in control. Okay, so next one, I have a choice in deciding what I do at work. It's the second vote. Okay, deciding what you do at work. That looks a little bit better. The people in this room seem to have a fair bit of autonomy, which may reflect the types of roles that you have. But, you know, think about some of the other people in your organisation and whether they might have the same response as you. Probably a lot of you are in management roles. But yeah, autonomy is a very important one. My line manager encourages me at work. Some people that share a line manager over there, maybe. Second polling. Okay, so mostly people have got encouraging managers, which is good to see. And, you know, for example, this is one of the things that's not too expensive to do. Doesn't require a program, it just requires some management training and some basic skills in how to lead people. This one is from colleagues, the respect I deserve. Something to think about while you're doing these is thinking about if the survey was in your organisation, what you're looking at is getting agreement, a certain level of agreement about these to know that there is something going on there, not to disregard people's individual experiences, but needing to look for patterns that are reliable to know that you need to intervene on something. So that's quite positive, although some people may not feel respected by their colleagues there, fair amount. And thinking back to our issue of bullying, you know, it basically does come down to that psychosocial safety climate in the work group. So this one is really quite important for preventing that. I'm clear what my duties and responsibilities are, otherwise known as sort of role clarity. So uncertainty, again, is one of those basic things, a fundamental psychological need that people feel is to have some kind of certainty about what they're doing. Okay, so again, most showing that they're clear on what their duties and responsibilities are, but some people only some of the time, and quite a few seldom and never. So, you know, that's quite an important aspect of our working life, is having, you know, a focus and an understanding of how our role fits in with the other people's roles in the organisation to achieve the ultimate objective. So having that sense of meaning of how what you do fits in. Really important. Okay, this one, subject to bullying at work, but we've had quite a bit of discussion that there's a lot of misperceptions around about what bullying actually is. But if we use it as this kind of leading indicator that there's something wrong in the social environment, if people rate this often and always. Second poll. So quite often in questionnaire measures there has to be a definition presented first for this one. Okay, so not too bad, but look, around that 12% saying sometimes, 3% often and always. So, you know, again, whether it meets the definition of bullying, if the person feels and perceives that they're being bullied, it will be having an impact on them psychologically, whether or not it's an objective reality. So this one, there's been quite a bit more focus on this in the last few years. Okay, the next, I think we've only got a couple more, but I'm trying to show you that even the briefest tool has quite a lot of aspects to it. Okay, one more. Okay. Okay, relationships at work are strained a fair bit, and I think this is one of the things about an indicator of a culture, and we used to call it morale or whatever, but it is about how we generally feel the relationships are, the quality of those relationships. So this is quite an issue in this room. I think I'm running out of time, so I'm just going to, I've just had the warning from Cameron, maybe stop on the polling questions if we could and go back to the presentation. Just had a few discussion questions and a time for standing up. Okay. So if you could stand up now, we do the partner chat as the format for these, and to the person next to you. If you can just talk about these questions here, what your experiences are of these factors that I was just showing, what resonates to you as a major source of stress, and how does your organisation manage this? Okay, so we'll have 2 minutes, Cam. Okay, I'm sorry to have to wind you up there. There'll be some more opportunities to chat after the other speakers. I've just got a couple more points to make. Thank you. And, I think if you want to continue the discussions around these points, the slides will be made available to you. Perhaps you can get together in clusters to discuss different approaches to this in your organisations. But I want you to remember that your experiences as mostly professional workers may be quite different to other parts of your workforce, and in particularly vulnerable workers and insecure workers. So we need to remember that our profile across the organisation may be quite different to our own experiences. As you saw before, a lot of us have high autonomy in what we're doing. Okay, so there's not as much research insights on the process of changing. As we said, we're moving from awareness to implementation and action, but we do know that these factors here are critical. So this is what we know so far from what we call process evaluation of putting strategies into place. So the one down the bottom there I thought might be interesting to mention. We were having a discussion yesterday. Mark from Beyond Blue was saying how Jeff Kennett had said that managers should be held accountable with KPIs for staff wellbeing. So that's an idea at the moment that's being discussed of whether that's feasible. And also not to forget that managers as an occupational group are extremely stressed, especially middle managers that are in the sort of the sandwich, the meat and the sandwich, if you like. Also, Pamela asked me to quickly update you. For many of you who attended our event in October, the university's Work Health and Wellbeing Network, what we were looking at there is using this integrated model to brainstorm in a range of stakeholders, practical people, researchers, psychologists, a whole range of practitioners, and we came up with 3 priorities for each of those areas, and that's one of the things that we'll be working on over the next few years. In particular, the prevention ones, which I've talked about today, and that's all about understanding psychological health and safety. So pretty much what I've been talking to you about today. Where to next? It's all of us working together on this problem around the world, actually. And I'm connected with people in all sorts of countries, had some amazing visits in Scandinavia. Everyone's experiencing these issues and trying to do something about it. So what I'll be doing is releasing this white paper that we've done with Deakin Uni as well. I'm a member of the WorkSafe Tasmania advisory group. Yesterday we were working on our strategy, so things will be happening. Also, an area that I've worked a lot on before is small business. Many of you might remember I had the Business in Mind mental health promotion program for small businesses. I'd really like to keep that work going. And at a national level, there's a lot going on at the moment around frameworks development. So I hope to come back to you at some point and let you know a little bit more about that in the future. But I'd like to just leave you with this takeaway point about doing psychosocial prevention is a great strategy because it doesn't rely on employees having to engage in a program. It's there as a kind of safety net, and then you have your programs on top of that. But if people don't want to participate in your mental health initiatives, the best thing you can do is protect their mental health. So thanks very much.